Here is a staggering statistic. On average, Americans are spending 13 hours or more per day interacting with screens. Before the pandemic, we averaged between 7 to 10 hours. All that screen time can damage our vision and affect our mood. We've got Dr. Scott Edmonds, Chief Eye Care Officer at United Healthcare Vision, here with us to give us some tips to cut down on our screen time. So first off, with all the virtual meetings and working from home, most of us are in front of the screens now more than ever. What's the potential health impact of this?
Well, all this screen time is leading to a lot of exposure to blue light. And blue light is that part of the visible spectrum that's at the high end, so it's high intensity light, really up near UV. And for years, we've known that UV light, which is invisible, damages the eyes, damages the skin. We protect ourselves from UV. But our recent research shows that a certain segment of the visible blue spectrum is also dangerous. That can give us both short-term and long-term health risks. So in the long term, we're worrying about age-related macular degeneration, with the degeneration of the retina from exposure to high-intensity light. And in the short term, we're worrying about disruption in sleep patterns and a new problem we call digital eye strain.
And so what are some of those warning signs of digital eye strain?
Well, the warning signs are kind of red, scratchy eyes after you've been at your computer too long. Sometimes your vision gets blurred or your eyes tear up. You get some headaches or stiff shoulders from hunching over the screen. We term all those symptoms digital eye strain.
And so what are a few tips that you have to reduce blue light exposure?
Well, some of the tips are quite simple. First, keep that computer screen or digital device about 30 inches away from the eye. The further the device is away, the less radiation or the less of the blue light can get in and damage the eye. The second thing is a rule that we have at United Healthcare, and this is called the 20-20-20 rule. And this rule says for every 20 minutes of screen time, you should take a 20-second break to look off into the distance 20 feet or further. When you do that, you relax the eye muscles, the converging muscle relaxes, the focusing muscle will unwind, and you're getting yourself away from the blue light. A 20-second break is all you need. Then you can go back to your computer, and you'll find that at the end of the day, you're going to be a lot more comfortable. The next piece is to leverage technology. So use the blue light filter glasses. It's a good idea to get them from your eye doctor so you know the source of the blue light. Your eye doctor can also make sure the prescription is correct. And the second part of it is to use the technology on your computer or on your phone. Use the night mode. That cuts out the blue screen. Certainly use that after 6 o'clock or when the sun goes down. And there are new computers that are from Dell Technology that have actual filters built into the screen that automatically filter out that narrow band of blue light that we think is dangerous. All these tips will make your eyes more comfortable and safe in the long term.
I definitely have to get some of those glasses. I think that this is something that's certainly impacting a lot of us. Thank you so much for taking the time. We really appreciate it.
Sure, thanks for being here.
Absolutely. And for more information about how you can cut down on your screen time, visit the United Healthcare website at uhc.com.